Infomagnetics Technologies presents IMT OQM, the Order Queue Manager. Managing the orders and results lifecycle can be a challenge for many healthcare organizations. Staff are required to register patients, input requisitions, and route lab orders to the appropriate hospital, lab, or clinic. In most cases, the process relies on either a fax or paper order from the physician. Once the lab test is completed, staff at the lab need to determine where and how to send these results back to the correct physician at the right practice. That's not always easy, since manual processes and paper requisitions make ordering lab tests slow, laborious, and error-prone. IMT Order Queue Manager, or OQM, automates the lab order and result lifecycle between ambulatory physicians and providers. If we were to take an X-ray of Order Queue Manager, we would see IBM InfoSphere MDM and IBM WebSphere Business Process Manager behind the scenes. These two powerful tools provide the patient and provider lookup as well as the workflow engine to manage orders seamlessly. Here's a view of the process. When a patient visits their physician, OQM logs the registration event in MDM, storing the patient demographics. When the physician writes the order, it is also logged in OQM, but this time it connects the provider to the patient with a relationship. When a patient visits the lab, Order Queue Manager serves as a tool to locate the outstanding orders for the patient. Internally, OQM validates the patient against the MDM database, validating the medical record number and account numbers along the way, mapping the correct patient to their orders, and allowing laboratory staff to release the orders to the lab system with a complete and accurate patient profile attached. Now let's take a look at the IMT Order Queue Manager interface. We'll begin by launching OQM, which is a web-based interface. The interface begins at the login screen for IBM WebSphere BPM Process Portal. We'll connect to the service and begin by searching for a patient. The patient search form is highly configurable. We can search using patient demographics, order ID, or by the medical record, such as one from NextGen. Let's enter the name of our patient, Ken Longfellow, and search. We see that Kenneth Longfellow is returned. The probabilistic search is invoked using nicknames and accounting for misspellings to optimize the search process. To see the orders for Ken, we simply click on the radio button next to his profile. The order status filter is currently set to display the orders that have not been released, but it can also display past orders or standing orders by clicking the drop-down menu. We see one order that contains 4 tests. These tests are highlighted in yellow because they have not been fulfilled. If part of an order requires fasting, for example, but the patient forgot, you can still complete the other tests, leaving the one that requires fasting still highlighted in yellow to alert you on the next visit from the patient. Let's select the order now, and we'll bring up the order details. These highlight the individual tests. Here, all of the tests are selected by default. We could uncheck the ones that the patient is unprepared for, but in this case, we'll simply release all of these orders by clicking the Release Selected Orders button. At the moment of release, OQM queries into the IBM InfoSphere MDM database to return the key identifiers from the electronic medical record system or practice management systems, including the account number, which helps to coordinate billing. Now the lab is able to process the orders with confidence that they have performed the correct tests for the correct patient and they know the correct provider to notify. Additional add-ons to the OQM process are available. These would include, say, the ability to notify physicians and patients that the orders have been processed. In conclusion, the order and results lifecycle for many healthcare organizations is a tedious, paper-based process. But with IMT-OQM, we can streamline the process, making the patient and staff spend less time while producing higher quality results. To learn more about IMT-OQM, please visit our website at imt.ca.